for the reader to understand. My recommendation number 5 would be to keep the community health assessment documents at a manageable length. It's easy for important information to kind of just get lost within the pages. And one of the things I found is some of the charts were contradicting themselves in places, and you really had to read through these. I mean, these were minor things, but if somebody did actually read through, then they would discover that, you know, there's a little bit of discrepancy. So for example, in one of the charts, there was a discrepancy as to how many hospitals are in that county. So, you know, just basic things like that. But if it gets really long, it's easy for things to get mixed up. Different people could be writing different sections. But keeping them at a manageable length would, you know, really help this problem. And also, I think meaningful information should be selected out and presented. Just including a lot of tables and graphs is not really helpful if it's, you know, not explained and, you know, an explanation is not given regarding what the importance is. My final recommendation would be to collaborate. Working together can really help overcome some of these smaller problems, and it can lead to a really good regional document. And the problems identified are very easy to fix. They just require a bit of planning in advance. Working together across all 8 counties really makes this process a whole lot easier. And we saw this in a lot of our meetings. When people are working together, it really allowed for good ideas to be shared back and forth across the table. So collaboration is key.
Yeah, folks have, I'm sorry, go ahead.
I'm sorry. So I just want to wrap up today by saying thank you. Working with the Western New York Public Health Alliance has been a wonderful opportunity for me and for other future students. It's a great chance to observe and learn about public health concepts. And I hope in the future more students would get the opportunity to work, attend meetings, and get mentored and benefit from this experience. Thank you all for a wonderful opportunity.
Thank you for a great job. By popular demand, the folks who participated with Anu Shri in these in the meetings are going to be convening here on the 29th of October to hear this presentation and to get into a little bit more depth about potentially some future planning. So thank you. It's probably the only overview that we've had, and I think you're absolutely correct. If we're going to continue to try to do this, people need to do some planning up front. By the way, Anu Shri is applying to dental school, and she has her first interview at her school of choice, which is UB, on the 13th of November.
Awesome. I love it.
So she's passed the first gate there very successfully so far.
Good luck.
Thank you.
She's going to be volunteering in the dental clinic in the meantime, too.
Yeah.
Questions?
Yes. Sorry. Questions?
Yeah, just a couple of questions, maybe one question and one comment. When you were referring to the poverty status, was that referring to the federal definition of poverty as the measure?
It's what was reported in the individual documents. They reported this is how much of a population is in poverty.
Did they make reference, though, to federal guidelines? I would think.
Yeah, I would think
8
it would
different
be
questions.
Yeah, State Department.
It's 8 different questions, I guess, is your point.
Yeah. Yeah.
And 8 different definitions.
Yeah,
Mhm.
yeah. So that would be part of it. One of the other things I think that even just going through this was interesting to note, and it does parallel what we're seeing nationally with respect to tobacco use, and that reflects the urban versus the rural. Right now we're seeing about a 2% difference, more smoking prevalence in rural than in urban, and it seems to be that on average across the nation, which suggests there's some things that might be able to go on in the rural communities that maybe we're not taking advantage of.
To tag along on that point, the way the information is collected, there was an increase in the number of people who reported that they smoke, which I think was like 30% for Erie County, but a decrease in the number of people who report that they smoke daily. So being a former smoker, there's a lot of people who are probably misrepresenting their actual smoking behavior because of the stigma that they're building. So I don't know how accurate the reporting is. But anyway, that's another
This
skewing.
pretty much parallels what the federal and state BRFSS collects. And so the numbers are at least consistent with that. So what we think is overall, is that it sort of evens out, underreporting, overreporting. If anything, you're probably right, it's probably underreporting the actual tobacco use thing. But it is consistent with the federal data.
Can you, to the extent it's reasonable, can you get specific feedback back to each county that, you know, obviously there's a lot of issues, but if, you know, you could point out the major ones to the individual counties,
Yeah,
they
I
might.
think we're planning to do that in our meeting,
Okay.
just discuss ideas about how to make it better next time. And I think just talking to the individual members of the health departments, a lot of times they don't get feedback, so a lot of them have never really received feedback before about their CHAWS. I mean, they send it off and they don't know if anybody's reading them. So this, I mean, I don't want to, you know, point fingers or make anyone, you know, this is more just, you know, how to do a better job from here. That's kind of what I would like to focus on.
Right, my only point is, if you're not comfortable pointing out, you county did this wrong in the group session, it probably would be helpful for you to say, look, you know, these numbers, you say two different things here.
Yeah, I think definitely like working together and seeing how the different documents look. I think that would be a really good starting point. Just in terms of the lens. I mean, they all include the same information, but just seeing, you know, maybe we don't need as many tables, or maybe there's a better way to say it.
Well, there's some, you know, as Amrishri and I had many discussions about this. You know, when you have this document fulfilling the same purpose that passed muster at 55 pages, and for the next most populous, or the least, one of the least populous, you have 325. You know something is askew right off the bat, okay? So, you know, there are some basic like rules of the game, and we were talking about this the other day, when you learn to write a research paper, or when you're trained at CDC to write reports on infectious disease outbreaks or food outbreaks. No tables, no data, unless there's a discussion of the significance, interpretation, or application. So what we see when Anushree is very kindly going data heavy, what she means is that, you know, people plow information in, it's not addressed, it's not interpreted, it's not, so there are some style things in addition to the consistency of the data formats that are used that really could help to streamline the process for the people who have to do it. So having compared them all across, I mean, I think she's in a really good position to make, you know, even more specific suggestions, you know. Yeah.
Just one of the comments though is the fact that I've been around a very long time. And the original community health assessment format that the state put forth was extremely prescriptive. You will do this, you will do it this way, this is what you will do. And a lot of the counties were complaining that didn't allow for individualization of the counties. And the state then said, okay, we're going to make an adjustment. I'm not saying it's right or wrong, but we want to give you more flexibility to be sure that you include those things that you think are important. And in doing so, I mean, it did give the flexibility, but it also lost some of the rigidity in terms
Crispness.
of structure that
Yeah.
you want. So you picked up that individual nature, but you kind of lost the general comparability that you might have had. If you said, please do this, these are the years specifically we want you to look at for these populations of people.
I think it's a very good point, and I think that's where planning ahead and picking out things they all want to include. I mean, that's very easy to do, and once we are looking at similar data, like same data sets, then it becomes very easy to just kind of go across all the counties and, you know, pick out information.
One observation is that this might be a training opportunity for the Alliance with the public health departments, because most of the people I'm assuming that are writing this are not professional statisticians or writers. They're the folks doing 10 other jobs trying to contribute their piece. So this is an opportunity to train them in what they should be looking for and how they should do
And
it.
it's only done once every 3 or 4 years.
Exactly.
That's right.
And some shots are done by a consultant who writes them. So you may have a difference in the volume of a report if it's done by a consultant versus if it's done by staff who are, like you said, doing other things as well.
Okay, thank you. Great.